Prostate cancer, when detected early and treated appropriately, has a high likelihood of being cured. Here are 10 reasons why prostate cancer can be considered potentially 100% curable under the right circumstances. 1. Early detection through screening. Prostate-specific antigen PSA tests and digital rectal exams (DRE) allow for the early detection of prostate cancer before it spreads. When identified in its localized stage, the chances of complete cure are significantly higher. 2. Slow-growing nature. Many prostate cancers grow very slowly, allowing ample time for detection and intervention before they become aggressive or metastatic. 3. Advancements in surgery. Radical prostatectomy. Surgical removal of the prostate gland is highly effective for localized prostate cancer. Modern techniques, like robotic-assisted surgery, improve precision, reduce complications, and enhance recovery rates. 4. Effective radiation therapy options. Advanced radiation therapies, such as external beam radiation therapy (EBRT) and brachytherapy seed implants, are highly targeted and can effectively destroy cancer cells with minimal damage to surrounding tissues. 5. Hormone therapy for early-stage cases. Androgen deprivation therapy (ADT) is effective in suppressing testosterone, which fuels prostate cancer growth, providing a curative approach when combined with other treatments in early stages. 6. Innovative treatments like focal therapy. Minimally invasive options such as high-intensity focused ultrasound (HIFU) or cryotherapy target cancer cells with precision, offering curative potential while preserving quality of life. 7. Active surveillance for low-risk cases. For men with low-risk, localized prostate cancer, active surveillance ensures the disease is closely monitored and treated promptly if it shows signs of progression, maintaining high cure rates. 8. Targeted drug therapies. Novel medications, like PARP inhibitors and immunotherapy, offer highly specific treatment options for genetic mutations or resistant forms of prostate cancer, improving outcomes. 9. Improved understanding of genetics and biomarkers. Advances in genomic profiling help tailor treatments to the individual's cancer type, enhancing the effectiveness of interventions and likelihood of a cure. 10. Lifestyle and risk reduction strategies. Adopting a healthy diet, regular exercise, and avoiding risk factors such as smoking can slow disease progression and improve the body's response to treatment, boosting chances of a cure. By combining early detection, effective treatments, and personalized care, prostate cancer has one of the highest cure rates among cancers, especially when addressed in its early stages. Thyroid cancer is often considered one of the most treatable and curable cancers, especially when detected early. Here are the reasons for its high curability. 1. Slow growth and early detection. Most types of thyroid cancer, particularly papillary and follicular thyroid cancers, grow very slowly. This allows for early detection during routine medical exams or imaging studies for unrelated issues. Early-stage thyroid cancer is often localized to the thyroid gland, making it easier to treat effectively. 2. Effective surgical treatment. Surgery, typically a thyroidectomy removal of part or all of the thyroid gland, is highly effective at removing the cancer. For many patients, surgery alone may be sufficient to achieve a cure. 3. Sensitivity to radioactive iodine therapy. Differentiated thyroid cancers, papillary and follicular, absorb iodine. This unique characteristic allows for targeted treatment with radioactive iodine, RI, which destroys any remaining cancer cells while sparing healthy tissue. 4. Excellent prognosis for differentiated thyroid cancers. Differentiated thyroid cancers account for about 90% of thyroid cancer cases and have a very high survival rate. The 5-year survival rate for localized thyroid cancer is nearly 100%, according to most statistics. 5. Hormone therapy is a supportive measure. After thyroidectomy, patients are often prescribed thyroid hormone replacement therapy. This not only maintains normal metabolic functions but also suppresses thyroid-stimulating hormone (TSH), which can help prevent cancer recurrence. 6. Genetic and molecular testing advances. Advances in genetic and molecular testing allow for personalized treatment plans and early identification of high-risk cases. This precision medicine approach further improves outcomes. 7. Low tendency for aggressive spread. Most thyroid cancers, especially papillary and follicular types, rarely spread to distant parts of the body. Even when lymph nodes are involved, the disease is still often curable. 8. Long-term follow-up success. Continuous advancements in imaging, biomarkers, and follow-up care contribute to excellent long-term management of thyroid cancer, reducing the likelihood of recurrence. Challenges and exceptions. While the prognosis for most thyroid cancers is excellent, certain types, such as medullary thyroid cancer and anaplastic thyroid cancer, can be more aggressive and challenging to treat. These forms often require a combination of surgery, advanced therapies, and clinical trials to improve outcomes. In summary, the high curability of thyroid cancer is attributed to its biological behavior, effective treatments like surgery and radioactive iodine, and the ability to monitor and manage the disease over the long term. Early detection and advances in medical science have made it a model for treating cancer successfully. Testicular cancer is often cited as a landmark in cancer treatment because it became one of the first cancers to achieve high cure rates, even in advanced stages, due to a combination of factors, including early detection, the biology of the disease, and groundbreaking treatments. Here's a breakdown. 1. Early detection and screening. Testicular cancer is relatively rare and most often affects younger men, ages 15 to 35. The cancer is highly treatable when caught early. Men are often encouraged to perform regular self-examinations to detect lumps or abnormalities. Early-stage testicular cancer confined to the testis has cure rates exceeding 95%. 2. Unique biology of testicular cancer. Testicular cancer is often a germ cell tumor, and these cells are particularly sensitive to chemotherapy and radiation. The biology of the cancer makes it highly responsive to treatment, even when metastasized, which is not the case for many other cancers. 3. Breakthrough with cisplatin. In the 1970s, cisplatin, a platinum-based chemotherapy drug, was developed and became a game changer. The work of Dr. Lawrence Einhorn revolutionized the treatment of metastatic testicular cancer. By combining cisplatin with other drugs like bleomycin and etoposide, cure rates for advanced testicular cancer skyrocketed to over 80%. This was unprecedented at the time, as most cancers that had spread were considered incurable. 4. Multimodal treatment approach. Treatment includes surgery, orchiectomy to remove the affected testicle, chemotherapy, and sometimes radiation. The integration of these modalities has been optimized, leading to high survival rates without compromising the patient's quality of life. 5. Long-term success rates. Today, testicular cancer has one of the highest cure rates among all cancers. Overall survival rates are around 95%, and for early-stage disease, the rates are near 100%. 6. Impact on oncology. Testicular cancer's success story showed that systemic chemotherapy could cure solid tumors. This inspired further research and advancements in cancer treatments. The lessons learned from testicular cancer treatment protocols have informed strategies for other cancers. Challenges ahead. Despite the high cure rates, long-term survivors of testicular cancer may face challenges, including side effects of treatment, e.g., infertility, cardiovascular disease, secondary cancers. The psychological impact of cancer treatment and survivorship. Legacy. Testicular cancer's treatment journey serves as a milestone in oncology, providing hope that even aggressive cancers can be curable. The story underscores the importance of research, early detection, and multidisciplinary care. Melanoma, a type of skin cancer, is one of the most treatable cancers if detected early. With advances in medicine, research, and awareness, it has potential to become a fully curable cancer. Here are 15 reasons why melanoma could be the first curable cancer. 1. Early detection possibilities. Melanoma often begins as visible changes in moles or skin, making it easier to identify early through routine skin checks. Early-stage melanoma has a survival rate of over 99%. 2. Public awareness campaigns. Global awareness campaigns about skin cancer have led to increased understanding of melanoma's signs, encouraging individuals to seek medical attention early. 3. Improved diagnostic tools. Dermoscopy and AI-driven diagnostic tools improve accuracy in detecting early melanoma, enabling earlier interventions. 4. Non-invasive biopsies. Liquid biopsies and advanced imaging techniques reduce the need for invasive procedures, making diagnosis faster and more patient-friendly. 5. Targeted therapies. Targeted therapies such as BRAF and MEK inhibitors directly attack mutations in melanoma cells, showing significant success in advanced cases. 6. Advances in immunotherapy. Immunotherapies, such as immune checkpoint inhibitors, e.g., pembrolizumab, nivolumab, empower the immune system to destroy melanoma cells effectively. 7. Genomic profiling. Personalized treatment plans based on genomic profiling of tumors improve therapeutic outcomes by targeting individual genetic mutations. 8. Increased sun protection awareness. Widespread use of sunscreen, protective clothing, and education about UV exposure significantly reduce melanoma incidence rates. 9. Skin cancer screening programs. Regular dermatological screenings in high-risk populations allow for earlier diagnosis and improved outcomes. 10. Vaccine development. Research into melanoma vaccines has shown promise in preventing recurrence and improving immune system response. 11. Improved surgical techniques. Advanced surgical methods ensure complete removal of melanoma in early stages, often eliminating the disease entirely. 12. Accessible telemedicine. Teledermatology enables individuals in remote areas to consult specialists and receive early diagnoses, improving access to care. 13. Advances in combination therapies. Combining immunotherapy with other treatments, such as radiation or chemotherapy, has significantly increased survival rates. 14. Research on resistance mechanisms. Understanding and overcoming treatment resistance in melanoma cells ensures sustained effectiveness of therapies. 15. Strong research funding. Significant investments in melanoma research have led to breakthroughs in treatment and prevention strategies, positioning it as a leading candidate for a curable cancer. With continuous advancements in science, technology, and education, melanoma is a strong candidate to become the first curable cancer, provided it is detected and treated promptly. breast cancer has become one of the most extensively studied and treatable cancers. Advances in research, technology, and public health initiatives provide a strong basis for it potentially being the first widely curable cancer. Here are 15 reasons that support this possibility. 1. Early detection through screening. Advancements in mammography and self-exams enable early detection, which significantly improves treatment success rates. The earlier cancer is caught, the easier it is to treat. 2. Highly targeted therapies. Breast cancer has many well-studied subtypes, like HER2 positive, hormone receptor positive, and triple negative. Treatments like monoclonal antibodies, e.g., trastuzumab, and hormone blockers specifically target these subtypes. 3. Genomic testing. Personalized treatment plans based on genomic profiles, such as BRCA1, BRCA2 mutations, help tailor therapies, improving effectiveness and reducing recurrence risks. 4. Improved surgical techniques. Minimally invasive surgeries, e.g., lumpectomy over mastectomy, and advanced reconstruction techniques have improved outcomes while reducing physical and psychological impacts. 5. Public awareness campaigns. Global campaigns have normalized discussions about breast cancer, promoting early detection, screening, and funding for research. 6. Hormone therapies. Effective treatments for hormone-sensitive breast cancers, like tamoxifen and aromatase inhibitors, are widely available, reducing recurrence and improving survival. 7. Immunotherapy advances. Emerging immunotherapies enhance the body's ability to fight cancer. Techniques like checkpoint inhibitors are already being tested in clinical trials for breast cancer. 8. Broad research investment. Breast cancer research receives significant funding globally, leading to breakthroughs in treatment, prevention, and diagnostics. 9. Global data sharing. International collaborations and databases like the Cancer Genome Atlas allow researchers worldwide to analyze trends, improve therapies, and identify new targets. 10. High 5-year survival rates. Survival rates for localized breast cancer are already above 90%, showcasing how effective treatments have become. 11. Preventive measures. Preventive interventions like prophylactic mastectomy for high-risk individuals, e.g., those with BRCA mutations, and lifestyle changes reduce the risk of developing breast cancer. 12. Advanced radiation therapy. Targeted radiation minimizes damage to healthy tissues while effectively treating cancerous cells, reducing side effects and recurrence. 13. Comprehensive support systems. Many organizations provide support for patients, from diagnosis through treatment and recovery, improving adherence to therapy and mental health outcomes. 14. Focus on metastatic breast cancer. Intensive research on metastatic breast cancer is paving the way for better therapies to extend life and potentially lead to cures. 15. Vaccines under development. Experimental vaccines targeting proteins like HER2 and others are being tested, offering the potential to prevent or treat breast cancer in the future. While breast cancer isn't fully curable yet, the combination of these factors positions it as a prime candidate for becoming the first curable cancer on a wide scale.